everybody, welcome back. Again, my name is Dr. Andrew Gorecki, owner of Superior Physical Therapy, and here we are in the clinic today. I'm going to teach you a couple quick tips on how to relieve back pain specifically for arthritis or stenosis related back pain. Okay, so this quick tip is going to be a strategy on how to relieve the symptom of pain quickly. It doesn't treat the problem long term, but it relieves the symptom of pain quickly. Remember earlier in the segment we talked about when you have stenosis in your spine or arthritis, the hole starts to become, the diameter of the hole becomes smaller because we're aging. But also remember, as we move, the hole can open or close. So a way to relieve pain quickly is to open up the hole. So I'm going to go ahead and grab a chair. Any chair will be fine. I'm going to sit on the front edge of that chair and simply flex forward, which is going to open up the hole. So a really neat strategy to decompress the nerve. So feet are shoulder width apart. We're going to gently reach down towards the ground. There is no requirement for how far you go. We just want to gently reach back and forth for about 45 seconds. If it feels better just to hold it, you can hold it as well. So 45 seconds, 2 or 3 times, maybe even 2 or 3 times a day, and you should start to notice some relief of the pain. And for our next tip, I'm going to show you how to reduce the movements that are causing the hole to close down. If you can remember earlier in the show, we talked about the muscle that lies in the front of the spine, and it actually attaches to the hip. And right now that muscle's totally relaxed. It's called the hip flexor, by the way, if you remember. But when you stand up, that muscle gets tension, and when you take a step forward, that muscle gets even more tension, and it pulls the spine into an extended position, which closes down the hole. So I'm going to teach you how to gain some flexibility in that muscle. So real easy, we're going to take that same chair that we were just using. Now, you can use a stairway or a chair. We just need something to get your foot up on. So here I am, I'm going to take one foot, I'm going to put it up on the chair. Right away I notice I need a little bit of stability to hold on to. So by all means, if you're at home and you're trying this, I want you to have your hands on a table or a wall or another chair. You have to make sure you're safe, number one. Number two here, we've got the distances like a big step forward, okay? Stairway works really good. This back leg is nice and straight. The foot is also straight. And we're going to gently take our body and move our pelvis forward. Right away, I start to feel tension right in the front of this hip. Well, guess what? That's the hip flexor. That's the muscle that's pulling your spine when you're having pain in your back from standing and walking. This is a natural way to relieve that tension. So we're going to try 30 seconds moving our hips front to back. Then we're going to move our hips a little side to side, 30 seconds. And then the last one is my favorite. We're going to go around in little circles. Of course, I'm going to do this on both sides. It takes about 1.5 minutes each side. And if you do this one 2 or 3 times a day, you're going to notice that walking starts to become less painful in your back. You're going to get relief of that sciatic pain naturally without medications, injections, and surgery, which is the name of the game.